Hi, you're listening to the Feelgood Factor podcast, brought to you by Health Bunker. And today I'm going to be talking to Dr. Thomas Levy. I'm sure you've heard Dr. Thomas Levy speak on other podcasts we've done over the last couple of years. But this one is episode number 3 on the Feelgood Factor podcast. And all we're going to talk about today is vitamin C, magnesium, and Dr. Levy's new book, which is called The Only Cause of Disease. Now, Dr. Levy, I asked him a question about where his thoughts on terrain theory versus germ theory. And his theory is that terrain is obviously important. If your terrain's toxic, then the likelihood is you're going to be ill. However, he's still his mind is that pathogens can cause illness as well, which obviously in terrain theory is the opposite. So I've kept an open mind on terrain theory versus germ theory since hearing about it going back to 2010. I remember listening to a podcast. A guy being interviewed was called Harvey Bigelsen. He was a doctor in the US that got struck off for giving people alternative therapies, basically. And I learned quite a lot of Harvey Bigelsen. I think his sons are still around. Talking about germ theory versus terrain theory as well. Now, I'm also of a different mindset, and I'm not a qualified practitioner, so I'm not saying I'm right or wrong. That if the governments are messing around with bioweapons, what we're told is a virus or a pathogen could be something totally different. Also, what makes us ill could be totally different. I'm all open for that. But one of the key things for me is that if you are ill, like I was with Lyme disease, what's going to make me better? So whether it's a pathogen, whether it's a parasite, whether it's a bioweapon, what's going to make me better? Because when you're ill, all you care about is getting better. And several things helped me get back to better health. One of them was diet. One of them was detoxing, using infrared saunas, things like that. One of them was supplementation. And two of the main things was ozone therapy and high-dose vitamin C via IVs, both IV therapy. And it didn't matter what was wrong with me. Those things work for all of the above. They improve your terrain. So that gets you rebalanced with terrain theory. They also, if you believe in germ theory, help your body dismiss what I suppose the Americans call bugs. Now, that to me, it doesn't really matter whether germ theory works, terrain theory works, or it gets rid of bioweapons. As long as I get better, that's where I'm at. And you might think I'm wrong. If you don't agree with Dr. Levy, that's fine. But that doesn't mean to say his information's wrong. And it certainly helped me. His books, Curing the Incurable, and helped me immensely. I've read his book several times. I used to have little markers in the books where he was showing the dosages. One of the important things to get into our understanding is the bowel tolerance levels of vitamin C. Now, it can differ, not just from person to person, but whether you're ill, how ill you are, whether you're just taking it for normal life, you've got no real illness issues. Everybody's tolerance will be different at different points. And getting your bowel tolerance up to your bowel tolerance is important. I've mentioned that I will take in a day roughly between 10 and 20 grams of vitamin C in a day. And I've been doing that for 15 or 16 years, and since about 2010, 11, something like that. And it doesn't mean you take it every day to make you rush to the toilet and it go through you like a Porsche. That's not what it means. But I will probably go into an explanation on that in another video. Okay, let's get on with it. Less of my rabbiting. Hope you enjoy the podcast.
podcast. Now please welcome your host, Dom Watterson.
Welcome to another Feelgood Factor podcast brought to you by Health Bunker. I hope everyone's in good health. Today's guest is a board-certified cardiologist, attorney, and author. He's known for his research and publications on orthomolecular medicine, specifically regarding the therapeutic roles that high-dose vitamin C, magnesium, and antioxidants play in maintaining good health. He's considered one of the leading authorities on vitamin C in the world, and his work focusing on the neutralization of toxins, the treatment of chronic infections, and the reversal of degenerative diseases has made a big difference to my life from reading his books and watching his lectures. After 15 years of cardiology practice, he researched the link between toxins in dental work, such as root canals and chronic disease, particularly heart disease and cancer. His books include 3 that I have in my own personal collection: Primal Panacea, Curing the Incurable, and Magnesium Reversing Disease, which I have to say, it's a must read for anybody. It's pointless listening to these things. You need it there documented so you can follow certain protocols and procedures that people like Dr. Thomas Levy write out in a way that even laymen like ourselves can understand it. So it's with a great pleasure to welcome back Dr. Thomas Levy. Hello.
Hi, Dom. Always glad to be here.
I know you're busy. You wrote a book last year. Have you got another one coming out as well? Am I right there, or?
Well, last year really is a few months ago. So
right.
This one is really sort of. I'm not saying there won't be more stuff in the future, but it's sort of a compilation, life's work that really encompasses everything else that I've talked about, plus some additional, I consider, exciting stuff. And it's entitled The Only Cause of Disease.
Right. So that's where I want to concentrate on that towards the end of this. But firstly, what I want to do is discuss those 3 books, really, and what got you to write them. I mean, coming from your background as in mainstream medicine, must have been a big leap to jump over into that type of research.
Well, Curing the Incurable was the first significant book, roughly about the year 2000, working with Dr. Hal Huggins, seeing what intravenous vitamin C could do, because he would use it as he was doing the treatments on all his patients, the dental work, etc. And I saw things happen that my modern medical training told me weren't supposed to happen, it didn't happen, and couldn't happen. And I'm not in the habit of denying what my eyes have witnessed. So shortly after I saw what the first IV vitamin C did to this very ill patient that Dr. Huggins had, and she was like newborn at the end of her procedure, where she should be worn down and wanting to go home and go to bed. She wanted to have her caregiver take her out to the best restaurant in Colorado Springs. And I said, something doesn't compute. And I found out she was getting 50 grams of vitamin C intravenously. And that began about 4 years of research. And I came out with Curing the Incurable, Vitamin C, Infectious Diseases and Toxins. Sort of encyclopedic. Some of it reads easier than others, but in order to cover all the bases, there's a lot of research out there. I mean, even though modern medicine doesn't discuss vitamin C at all, we have over 85 to nearly 90,000 articles in the PubMed literature on vitamin C and everything it has done in plants, animals, and human beings. So that was the first significant work. Primal Panacea came along later and is shall we say, a condensed version, more clinical, on what vitamin C does. It also touches a great deal on the political suppression of vitamin C. So that sort of puts together the clinical impact of vitamin C and really how it threatens so much of modern medicine. I mean, if vitamin C were completely and totally embraced, it's my opinion, you could do away with at least 70-75% of prescription medicine. So we know how well that would be accepted. And then more recently, Magnesium Reversing Disease, which sort of followed Death by Calcium. And calcium and magnesium are sort of the yin and the yang It might have been a more clever title after Death by Calcium to entitle the magnesium book Life by Magnesium,
Mm.
because as incredibly important as vitamin C is, there's no single thing or no single supplement, I should say, more important than magnesium, because elevated calcium, which magnesium reduces, underlies the pathology and the oxidative stress in all diseases 100%. So in everybody is low on magnesium. They like to say, oh, maybe 70, 80%. No, everybody. There may be a few newborns and a few young kids or something like that haven't quite had all the toxins hit them that has hit other people for 10, 15, 20, 30 years. But magnesium is critically important because it makes every disease better and resolves many diseases for which it's the primary cause. And you simply can't get enough of it. Uh, Vitamin C, of course, is very important, but I like to say magnesium is the most important because nothing can address a magnesium deficiency other than magnesium. Whereas, and I'm not recommending this, if you're not taking vitamin C, other quality antioxidants can partially compensate for the lack of vitamin C intake. So, just to make an academic point more than anything else, I say magnesium is the most important supplement because nothing can replace it. Obviously, you should take more than magnesium.
And also, I mean, with vitamin C, we don't produce our own vitamin C. That's one of the main issues with vitamin C, isn't it?
That's correct. I mean, most of the wild animals, except for a few species, convert the glucose that comes from glycogen breakdown of the liver. It converts that glucose into vitamin C through a 4-enzyme sequence. And we have the same sequence in our liver, but we lost the proper translation of the 4th enzyme. So we're deficient on the final step of converting glucose into vitamin C. And as it turns out, the animals that make it make enormous amounts. So this gives us a direct indication that we don't need just a little bit of vitamin C. We need a lot, because we should be making multi-gram doses around the clock and injecting them into the blood. A goat that's about the size of a human being will make 7, 8, 9, 10 grams a day. That's 10,000 milligrams directly into the blood. And if you give that goat a life-threatening infection, a toxin, it will make 20, 30, 40, 50, 60, 70 grams until it gets over that infection. So that's why so many people, when they get sick, they stay sick, is because their liver's not kicking in the way it should.
I remember following your protocols in curing the incurable. I think it probably was some of the protocols in there when I first, about 2010-ish or something like that, when I started doing high dose vitamin C. This was using sodium ascorbate based on what you were showing to do. And I noticed my symptoms, unknown at the time. I didn't know I had Lyme disease at the time. They damped down. This was only oral powdered vitamin C as well. So all my respiratory stuff damped down. If the kids had colds, I gave them, and I used to boost them, giving them bigger doses. And I could tell that they got better quicker. They weren't as ill as longer. They didn't take a lot of recovery. And then you started passing it on to other people, and it's amazing how the word spreads.
Absolutely, absolutely.
But that's all from your book. That's all from the book that you wrote in 2000 that I bought, and it's something I wanted to ask. I don't know whether you guys, and I'll say guys and women, in the early days of YouTube when you were releasing videos. Like yourself, Dr. Schallenberger, Robert Rowan, Susan Humphreys, Ron Hunninghake, and yourself. Did you realize the impact it was going to have?
I realized the impact it could have.
Right, okay.
I mean, you never know how well something's going to be picked up, how viciously it's going to be suppressed. And it's been suppressed pretty viciously, but there's still enough people that have gotten benefits from it that the number kind of grows. I mean, if your next door neighbor, and you have a problem, and your next door neighbor said, well, I went to Dr. So-and-so down there, got this IV vitamins, got this, and now I feel great. And that neighbor does it, and maybe had cancer, maybe had this, maybe had that, and they're doing great, and they don't need the medicines. or don't want to take the medicines anymore that their mainstream doc gave them, the word does spread. The only question is, again, how quickly and how vigorously. And I can say we're all impatient when we're trying to get something out there, but overall, considering the fact that like legal processes, believe it or not, medical processes proceeds at the rate of a glacier.
Yeah.
And in that regard, I think probably 30 years is not such a long time for major shifts in the way medicine is practiced to occur. And as horrible as it was, the pandemic gave orthomolecular and alternative and complementary medicine an enormous shot in the arm as the public got to see with their own eyes how many doctors were, I'll say it, just plain evil in what they did and what they refused to do. And then later seeing a lot of studies come out.
I got the nurses at our clinic. I generally have it every few weeks, 35 grams of vitamin C or 40 with magnesium, zinc, selenium, B vitamins, including
When you have
B12.
easy access, it's a wonderful thing to do on a regular basis.
15 years ago, I used to dream of it, and now it's sort of it's on tap, if you like. And I had ozone Tempass as well, by the way. I mean, ozone's something else I wanted to talk about because you're going to be a film star, aren't you?
There have been a number of movies. I guess the Ozone movie, I did some videotaping in Argentina. I think that was it. And
Right.
so I don't know. It should be coming out. Oh, 03 the movie or something like that.
That's right. Something like that. Is it called 03 the movie? Yes. Yeah. But hopefully that takes it, not necessarily to, my wife says, I hope it goes to a mainstream audience. And I said, I don't really, because that means then that the wrong people will see it as well as the right people. Sometimes some things are better kept at a lower volume, aren't they? Of people.
Well, the Root Canal movie, quite a few years ago, lasted a few weeks on Netflix before the collective Venice lobby, I mean, just raised such holy hell that that it got yanked. But the cat was out of the bag. I mean, that obviously, had it stayed on Netflix, it would have reached even more people.
Yeah.
But still, the fact that it got yanked like that, and then that readily available on other sites, a lot of the good information still escaped the suppressive hands of quote unquote modern dentistry.
I mean, the closure of a lot of sites on, say, on YouTube over the last 10 years, even before 2020, they were pulling the plug on pulling videos down and things like that. I was fortunate. I was downloading them.
They're still doing it. They're still doing it.
Yeah, they are. You've got to be very careful. Even what we're talking about now, some of it will be okay. I'll have to go through it with a fine tooth comb to put it on YouTube. And so you just can't talk about certain things. It's impossible. But it's simply because when I did my research into Google, they were funding a lot of the COVID vaccine companies. They were part of the funding of, I think it was AstraZeneca and a few of the other companies. So, they're part of it. They're part of the, whatever you want to call it, the New World Order, whether we like it or not. The New Medical World Order, probably. So what I wanted to ask about Primal Panacea, is it right that you took it, you saw that book went back to, reason it's called Primal Panacea, because it went back to pre-human or pre-man, if you like. Did it? If I read from memory now, I'm thinking, did it talk about we used to be able to produce our own vitamin C? Am I right there?
Sure. And I mean, that basically tells you it's the primal panacea. Okay. It took care of everything. I mean, animals in the wild, are they injecting themselves with insulin for diabetes? No, but we are all the time, because we lost that ability to convert glucose into vitamin C. So not only do we suffer from a deficiency of vitamin C, we suffer from a chronic excess of glucose that should be the substrate for making a lot of vitamin C. So we should be chronically keeping our glucose levels down while keeping our vitamin C levels up if everything was functioning right. Let me say this for people listening too. We do have, I don't want to call it a complete solution, but perhaps a complete solution for some people, as many people have responded to this. They have a substance called hydroxytyrosol, a polyphenol that's present in high concentration in olive leaf extract. And they have a lot of studies that show that when you take roughly 50 milligrams, which is one or two capsules of a quality olive leaf extract a day, you allow the enzyme to start being made again in the liver, and you're able to start manufacturing your own vitamin C again. So it makes it a significant supplement.
Really? That's pretty amazing, that, isn't it?
Absolutely.
Yeah. So, and curing the incurable and these books, how long do they actually take you? Did they take you to put together? I know it's sort of like a more of a mechanical question, but
Curing the incurable was about 4 years. I mean,
right.
that was. I mean, I had not just abstracts, but I mean, I went to the trouble. I had a good hospital library that was willing to pull things from around the country and in certain cases from around the world. And I got printouts, full article printouts of probably over 1,000, 1,500 articles. And, that takes a little while to go through. And then putting it into a cohesive pattern. I will say this, I want to give credit where credit's due. The Irwin Stone, who actually introduced vitamin C to Linus Pauling for the first time, Irwin Stone wrote a very similar book to Curing the Incurable, going down the different diseases. And in many ways, I want to be straight about this, I use Irwin Stone's book as a format to bring up to date the subsequent 50 or 60 years of literature that had come to pass since he had written his book. Okay, along of course with other stuff that added in there. So it was just a way of trying to update the information as completely as possible on what our literature had done in further evolving the science of vitamin C since Irwin Stone, Dr. Stone, first wrote his book quite some time back, I think in the 70s.
Because it's not a new thing, is it? Let's face it. I mean, in the 30s and 40s, they were, I'll say experimenting, but using vitamin C IVs, in fact, before that, and treating, and dare I say, curing serious illnesses in people.
Well, it was in 1937 that vitamin C was discovered, and he's such a famous person, and the name is escaping me right now, discovered vitamin C and received the Nobel Prize in medicine or literature. And Dr. Frederick Klenner, within a few years of that discovery, somehow, this is amazing, really, somehow convinced some of the drug companies to start making vitamin C en masse. Wow. Even more amazing, in my opinion, was somehow Klenner had the idea that I'm going to take this vitamin, which nobody has ever administered intravenously before in the history of medicine, and give large multi-gram doses of it and start knocking out infectious diseases. So some touch of genius or brilliance or gift of God entered his head, because I just don't know how, as we say in Latin America, he could have had the cojones to do that.
Was it Albert? Was it Albert Sainz? Georgi. Yeah. I couldn't remember the name myself, but I mean, Klenner was curing all sorts of things, weren't he?
Klenner is the father of vitamin C therapy and vitamin C everything. I mean, what St. George did obviously was important. He discovered and characterized vitamin C, but he wasn't a clinician, and he might have had some ideas as to what it could have done. But Frederick Klenner was the one that picked up the ball, somehow had these incredible realizations in his head as to what an agent like vitamin C could do given in large amounts. I mean, literally curing all the infectious diseases and negating and neutralizing virtually all toxin exposures. I mean, his very famous paper, 1939 or 40, where he took 60 acute polio patients in the middle of a polio epidemic in North Carolina, and with a combination of oral and intravenous vitamin C, completely cured 57 out of 60 in the first 3 days, and in the last 2 days cured the other 3. So he cured 60 out of 60 cases of acute polio with just vitamin C therapy. And as I like to say, just a little bit tongue-in-cheek, 60 out of 60 is pretty doggone close to 100%.
I mean, I bet the drug companies wish they could get to that type of result.
Oh, yeah. We'd never hear the end of it. I mean, it'd be it'd be a 30-second commercial you'd hear every 5 minutes, on the hour, on the hour, on the hour, on every station, no doubt about
I
it.
mean, the amount of times I've been to, I'm sure you've got it a million times. Well, if it was that good, why isn't the NHS using it? Vitamin C, that is. Now the people that are telling me that this was pre-2020 are now buying products offers. Like my next door neighbour, for instance, is buying vitamin C offers now.
Well, let me give you a cynical but honest answer. Assumes, makes the assumption that most people would think valid, but I say is not valid, is that the welfare of the patients is their primary concern. I don't accept that, and I don't believe that.
Yeah, I think I'm on your side of the fence now, because it's quite blatantly obvious. Because if they did, they would not just use. I mean, even if they wanted to go down the role of drugs, they would bring some of these treatments in that quite obviously work. Yeah.
There's another thing too, that our famous person Mark Twain, I think, without even being able to addressed it very perfectly. I mean, there's an enormous arrogance, not only in medicine, but in law, in any professional situation, and really in any situation where there's a group of people who have done something a certain way for a long enough period of time, regardless of how much or how little money they make. That's the way it's done. And Mark Twain said, you can fool anybody, but you can never convince anybody they've been fooled. So you simply cannot introduce something, medicine, law, anything else, that's going to force that person to realize, number one, that they didn't know it, but even more importantly, number two, that what they've been doing is wrong or not optimally correct.
Yeah.
It just doesn't happen. That's human nature. And really, that's another reason why we talked about earlier, why things are starting to build now, is we now have a lot of new physicians, new healthcare providers that are in on the ground floor. So they don't have to be told what you've done for 20 years is wrong. They're being said, they can just look at something objectively. Wow, this works. This doesn't work. This causes horrible side effects. This doesn't, and proceed from there without having to renounce or even acknowledge that, hey, I might not have intended it, but I didn't help my patients that much, and I might have hurt a lot of them too. Yeah. I mean, no doctor is ready to accept that, whether it's true or not.
No, I mean, the difficulty for older doctors is they're roped into the system with the pensions and things like that. Where a new doctor that are coming up, they're getting paid peanuts in comparison. So they can make that decision right there and then, can't they?
There's an expression, I won't get it precisely word for word. Basically, it states that you only get major advances when all the old ones die off and the new ones come along ready to be educated. And it's true.
It is, yeah. I can see I call it an awakening of healthcare anyway. People wanting to take control of their own destiny as opposed to relying on the pharmaceutical companies.
Well, for all the negatives that people talk about, the biggie there is the internet. I mean, people now have immediate access to so much information. Obviously, you need a acquisitive mind to balance one source versus the other. But I mean, these days, you go on the computer and say, what do I do for this? And you get a laundry list. And then when you go see your doctor and your doctor doesn't know half of that list, you say, hey, maybe this is not the person that I should just blindly put my health care in his or her hands.
Yeah, well, you can only look around you and say that health's getting worse, as in the people that are taking advice from them people.
That's right.
Yeah. Are you still a director of Riordan Clinic?
No, I'm never been a director of Riordan Clinic.
A board member.
I'm a board member. Yeah, I've been a board member.
Sorry. Yeah.
And I'm a clinical consultant. Okay. I'm not physically there. I interact a lot with Dr. Honey Hackey on the phone. We have some conferences we go to, but Dr. Honey Hackey and I together help design the treatment protocols and hopefully optimize them and tweak them and eventually get some information on it published.
We try to follow a lot of your guys' IV therapies, high dose vitamin C therapies, which I like to talk about now. Actually, but is it just cancer patients you treat at the Riordan Clinic, or do you treat people with many other illnesses?
They got some well people that come, other people, probably mostly chronic infections
Okay.
and
Like,
cancer.
like Lyme disease, for instance. Yeah.
Exactly. Chronic infections and cancer are probably the two main groups of patients that get treated at the Reardon Clinic. And it's important for people to realize too, the Reardon Clinic is a treatment facility. I mean, they do blood work and this sort of thing, but some people, they seem to get the wrong idea. They come to the Reardon Clinic and they don't get uh, all the magnetic resonance and scans and this, that, or the other. That's for the Mayo Clinic to make their millions of dollars, because all they really do is diagnose, in my opinion, and don't know that much about optimal treatment. Whereas the Reardon takes patients who have their records, they have their diagnoses, they're looking for something either different or an additional to the treatments that they're getting. Oftentimes cancer patients, and hey, I heard vitamin C helps a lot, so they come in for that, and that's more or less the subgroup of patients that the Reardon Clinic sees.
I would say that it's inspired a lot of people like myself to open a clinic as well. Listening to you guys talking about it. So again, the word spreads, doesn't it? And it's not just about making a living and making money. It's about spreading the word that people to help them get a healthier life, and also question the authorities and what they've got over you in a way. But that's the rebellious side of me. I'm sure you've got that as well, by the sound of it.
Yeah. Oh yeah. I mean, after I wrote my book, Rapid Virus Recovery, in 2021, hydrogen peroxide nebulization to deal with acute COVID, which it dealt with enormously well, I might add. I got chastised by the Colorado Board of Medicine, and I had my board certifications in internal medicine and cardiology stripped from me. Bad boy.
That means you're over the target somewhere.
Exactly.
I think that's a recommendation now, Dr. Levy.
I'm not saying I appreciated that per se, but actually, yes, it's a red badge of courage and an index of validation.
Yeah.
Especially in light of what happened in the pandemic going up to that. I mean, Resdemivir and all the renal failure and this, that, or the other is just horrible
Stuff. I mean, over here, they called it the Liverpool pathway to death. It was go on, sorry.
I mean, early on in the pandemic, whoever the Nevada governor was at the time, the Nevada governor, politician, had an executive order that banned the prescription of hydroxychloroquine by physicians, which is also enormously benefit. I mean, I never even thought or conceived of the possibility that a politician could ban the use of an established non-toxic prescription medicine.
That's up there with any sort of dictatorship that we've been told about over the years, isn't it?
In my mind, for sure. Yes, sir.
You can't even begin to imagine, but that's even forethought pre 2020 pandemic, isn't it? That's, they must have been planning. They knew about these drugs prior to that happening. So,
well, they had their own doctor tell them, hey, you don't want to let this drug out there. It's going to cure too many patients. It's going to keep too many patients from getting in the hospital. The enormously effective drug.
But the silly thing with ivermectin and things like that, now it's so, because they push back against that drug so much, it's now even normal people are asking me where they can get it from to help their anti-cure this, or their anti-help them with a cancer with ivermectin or something. So they've even opened that door for these people now. They've actually made people wiser.
Well, one of my dearest and most intelligent friends, but completely non-medical, a lawyer in another state, I got on the phone about that time years ago and talked about ivermectin. He said, "Oh, you're talking about that horse medicine?" I said, "Oh my God, not you too. Come on, It's called medical data. It's called scientific information. And just because it helps horses, another biological organism, doesn't mean it's not going to help people too." And I mean, but at the same time, I realized, wow, if they can brainwash somebody as clear-headed and open-minded and intelligent as this particular friend, I really saw and got the lesson of how powerful medical propaganda is.
I mean, that was not just medical propaganda, was it? The whole machine pushing behind all that. It
Oh,
weren't just it weren't just medical propaganda at that point. It was everything, weren't it? It was like it was on a war footing level, wasn't it?
absolutely. Yes, sir.
So let's get to your new book before we burn up all the time.
All right.
What's the title of the book again? I was trying to look for it on Amazon. I can't see it on Amazon. Is it not on Amazon yet?
No, it's not on Amazon. It's on my website and it's on MedFoxPub, MEDFOXPUB.com. And let's see. Here's the book. It's entitled The Only Cause of Disease. And I wanted that to be a provocative title, not because I wanted to be pushing any propaganda, but in addition to being provocative, because everybody and their docs think there's a million different reasons for getting sick, but there's not. There's only one, okay? And that only one is agents that oxidize biomolecules. And the only agents that oxidize biomolecules are toxins. So the initial title that I was going to use, but until I thought about the only cause of disease, title was going to be Toxins Cause All Disease, which would have been a good title too. But this title was very important because it brings home the point that when you have any disease at all, no, it doesn't matter what it is, and the cells that are involved in that illness, there's only one abnormality, and that is an excess oxidation of biomolecules. So when you have RNA, DNA, enzymes, sugars, proteins, etc., in a non-functional oxidized state where they lost the electron to a toxin, they lose their function. And when you get enough biomolecules not functioning, participating in metabolic pathways, you have the manifestation of abnormal physiology and a disease process. But what you see in the literature, and this is called oxidative stress. Oxidative stress is a very common phrase, but it's misinterpreted and misunderstood. The literature would have you believe oxidative stress causes disease. Like once you oxidize all those biomolecules, something else happens. No, the oxidative stress doesn't cause the disease, it is the disease. And that also is very well demonstrated by the way in which different people with different conditions respond to the biooxidative therapies. So that in a nutshell, and just so people understand, oxidation is when a stable molecule loses an electron. Then it becomes unstable, electron deficient, and no longer functions in metabolism. And when you have something like vitamin C come along and redonate an electron back to that biomolecule, you literally heal it. And it's a normal biomolecule again with normal function. All the different toxins cause all different diseases, not because they do something different, they all oxidize, but because they have different chemical qualities. They're fat soluble, water soluble, ionized, they go here, they go there. And that determines which biomolecules a given toxin oxidizes, and that determines whatever your disease process is. Then having established that particular premise, then the really goal of the book is the three main toxin sources and the primary ways to deal with them. Now, lots of toxins out there, thousands upon thousands, that can all make you sick if you get enough of them. But statistically speaking, what makes most of the people sick most of the time and causes nearly all heart disease, nearly all breast cancer, right there, that's more than half of the world's population that dies other than starving populations. What are then the three main sources of toxins? Number one, well, pathogens, and the pathogens are nearly always located in the mouth. Root canals, abscessed teeth, tonsils, infected gums, and the fact that when you swallow these toxins, which everybody does, they poison your gut. And then your gut becomes an abnormal microbiome, a leaky gut, and further promotes the dissemination of these pathogens and infectious processes throughout the body. That causes it most of the time. Number two is accumulated heavy metal toxins, mercury, lead, arsenic. I'm a cardiologist, and I'm telling you, I have the data now to show that virtually all in large failing hearts have enormous concentrations of mercury, antimony, another heavy metal coming from plastic and other things. So those need to be addressed. And then number three, unfortunately, but true, is persistent spike protein. Long COVID.
I just wrote that down here. I just wrote it down. Yeah, we're gonna ask it.
That's number three. That's number three. And the really nasty thing about the spike protein, which is addressed in the book, is you need to assume as a physician, as a healthcare provider, that when your patient comes in with anything, that part of it may still be long COVID and persistent spike protein, because it will cause any symptom imaginable. So you need to work hard on ruling that out, getting tests like D-dimers that show whether or not the spike protein has abnormally activated your clotting system, which probably causes most of the acute deaths, which is the pulmonary embolism, heart attack with blood clots, and other diseases, strokes in the brain, thromboembolic. But those are your big three. And then, of course, therapeutic are the biooxidative therapies. Vitamin C, applications of hydrogen peroxide, ozone in its many applications, ultraviolet blood irradiation, and a lot of different variations there, and hyperbaric oxygen therapy. Those 5 modalities, along, of course, with obviously quality supplementation to address all the nutrient deficiencies in your body. I mean, a therapy is not going to put nutrients into your body. So that's an important part of the plan. But the thing is that it turns out virtually all disease, not virtually, all disease is caused by toxins, but most of the toxins come from ongoing pathogen colonizations. Okay, so not infections, but colonizations, kind of like they're just growing on a mucous membrane surface, but they're not causing a gross infection. And you might feel well, you might feel fine, but you're swallowing this 24/7. It's been shown in the literature that, like people with Parkinson's and Alzheimer's, if you actually have biopsy specimens and culture those specimens, you grow out the oral pathogens. Okay, they're sitting there growing on site, producing new toxins every day. Because if you had any chronic disease tissue with increased oxidized biomolecules, but no new toxins coming in, your good diet and your good supplementation would completely reverse all that biooxidation, and you'd have a normal tissue again and no more disease. But that doesn't happen. It doesn't happen because these diseased tissues have pathogens growing on site, continuing to produce the new pathogens every day. As my mentor, Dr. Huggins, told me 30 years ago, somewhat sarcastically, because I was asking a question that was kind of dumb, and he looked at me somewhat condescendingly and said, "Tom, you can't dry off while you're still in the shower." Okay, so you can't resolve a disease until you resolve what's not only causing it, but continuing to fuel it on a daily basis.
Yeah, and that makes sense. I did ask you beforehand about. I know people are gonna. Since 2020, a lot of people got into the germ theory versus terrain theory, and I like to keep an open book, having had Lyme disease and seeing what vitamin C and ozone and diet and things like that can do to help heal from these things, and then get retested and show the co-infections have disappeared because of the treatments, ozone and vitamin C, that I was having. I can say that terrain is a very important thing. If you get your terrain better, you're going to not get as many infections. I think that's what the basis is, isn't it, Dr. Levy?
Well, like I said, unless you have an enormous toxin exposure or an enormous pathogen exposure, and you don't have an indwelling infection, obviously, a good competent immune system with high levels of vitamin C at every site, all your cells, you're going to be fine. But I mean, people say, "Why did I get that cancer? Why? I mean, I'm lucky. I'm this, I'm that." Well, you're unlucky for sure, but it wasn't luck that determined the cancers. The fact that, I mean, there's cited in the book, there's probably over 15 or 20 different cancers researched, and each one of them, when you do a biopsy of the tissue in and around the cancer site, you grow out pathogens. You only get cancer when you get astronomical increases of oxidative stress, and it's the toxins associated with pathogens and produced by pathogens that push you to the maximal level of oxidation short of cell death. I mean, that's what chemotherapy does. You increased it so massively the cancer cell ruptured. But when you get the oxidative stress extremely high, but not to the point of causing cell death, that's where you develop your cancers.
So a lot of people say, though, the reason that bacteria are in these cells is because they're the firefighters. They're trying to get rid of
not bacteria, pathogens.
Pathogens. So we're talking about two different things here. Can we just identify what we're talking about with pathogens and bacteria?
Yeah, pathogens is a species of microbe that tends to proliferate very rapidly. In many ways, if you will, it's analogous to a cancer cell run amok. A pathogen is not a quiescent microorganism. It's one that wants to replicate. And if you don't have good opposition from your immune system, it just takes off. But no, with very rare exceptions, I mean, of course, you know, the microbiome, we have more in a healthy person, you have far more microbes than you have cells in your body. Okay. You have far more. I mean, so, and when you have a normal microbiome, there's an enormous amount of literature to show that the normal bugs interacting correctly all positively impact immune function, digestive function, and just about every other normal function in the body. But when you get pathogens, which proliferate very easily and usually uniquely produce toxins, produce metabolic toxins. So they produce exotoxins. When they die, they rupture and they've accumulated an enormous amount of free iron, which is highly pro-oxidant. So no, I mean, it's we live, our bodies, bacteria don't live in our bodies. We live in a sea of bacteria.
Yeah. So we started on the book. Let's, because obviously it won't be just about that those three things. What other details are in the book that you want to get over to people?
Well, it goes into the main sources of pathogens, shows you how to deal with dental pathogens, because that's a big one, shows you how to properly chelate toxins. I mean, everybody should be chelating because that's a primary reason people get so sick when they're 50, 60, 70. There you go. Is they finally yell, "Uncle, a little more toxin suddenly has a tremendous effect because the tissue involved has already accumulated so many toxins." It goes into a lot of the detail about spike protein. There's a big extended discussion on what I call the important metabolites, calcium, magnesium, vitamin C, glutathione, and ATP, adenosine triphosphate, the main energy molecule in your body. It goes very importantly, this is a critical point that I'm glad you asked that question because it's sort of coming back to me now, is that the immune system and vitamin C. When you have an area of inflammation, any disease involves inflamed tissue. All inflamed tissue is severely vitamin C deficiency. So when a tissue is inflamed, it's vitamin C deficient. When you use up all the vitamin C in a certain area, the tissue becomes inflamed. Inflammation means vitamin C deficiency in the inflamed tissue. Period. End of story. Then you add to this fact of what the immune system does. We have examples, it won't take up too much time, where when you have inflammation, the first cell to come to the inflamed site is the monocyte. The monocyte has enormously high levels of vitamin C in it, 80-fold, 8,000% more vitamin C in it than the surrounding blood and tissue. So the immune system is serving to try to replenish the inflamed tissue with vitamin C. It's so dramatic, and in my opinion, and I lay out the picture in the book so you can, there's a lot of references, over 2,000 references, so the reader can decide for themselves and look at it. But I make the assertion and the statement and the point that the primary, almost only, but definitely primary role of the immune system across the board is to restore vitamin C where it's deficient in the body.
Wow, that's quite a big jump, isn't it?
Yeah, I mean, I like to say there's enormous things that are simple in medicine, and there's lots of things that are complex. The underlying biological principles are really very simple, but that doesn't mean resolving them is easy, and we go into all these other avenues.
I can only speak from myself and what I've witnessed with vitamin C from people coming in and having high doses as well. That that it's something that you can apply that never has side effects. I mean, how unusual. I mean, ozone's the same. How unusual is that in treatments? In most treatments, well, especially pharmaceutical treatments, there's going to be some kind of side effect.
Well, literally, vitamin C is the only molecule that I know of. Maybe some others exist. Only one that know of, and I've looked hard to find other ones that is completely devoid of side effects.
Mm.
There is no toxic level of vitamin C. All right. So, when you have the rare, shall we say, complications, they talk about the kidney stones and all that. That's not vitamin C. That's the fact that the vitamin C came into a body that has excesses of calcium. Okay. Because the stone is calcium oxalate. All right. Vitamin C and many other things produce enormous amounts of oxalate, but if your calcium balance is normal, there's no stones. There's no abnormality there. In fact, vitamin C in experimental studies puts calcium into solution better than hydrochloric acid and sulfuric acid. So it's really just the opposite. The studies show actually that the more vitamin C you supplement, the lower your chance of kidney stones.
Yeah, and well, I can't. I think it saved my life, to be honest with you, because when you're really ill with Lyme disease, I mean, you've seen people really ill with Lyme disease. It's well, it's debilitating to say the least. But one thing I wrote down here is chelation, and there's many ways to get rid of toxins. Do you want to explain to people what that is, chelation?
Oh, okay. Well, for clarity, I would call it chelation.
Chelation. Oh, sorry. Yeah, my accent. Sorry. Yeah.
So with chelation, there's a little bit of confusion. Okay, there are things that will get toxins out of your body that don't involve chelation. In other words, enough vitamin C and other antioxidants go into the cell, and if the cell has sick, it has a lot of oxidation, and the enzymes that eliminate toxins, glutathione base, when you reduce them and bring them back to a normal state, then they start dumping toxins out. That's one thing. Chelation, on the other hand, is when you have a molecule that completely clamps onto that molecule, that toxin, and then the whole complex is properly excreted.
Mm. And then there's other ways of detoxing. That wooden box there's an infrared sauna.
Yeah. I always tell people, if you can afford it,
yeah,
one of your best investments ever in your health is infrared, dry infrared sauna, and use it regularly. But just be sure you take extra magnesium, because you do lose a lot of magnesium in your sweat. But just about everything else you want to lose.
One of the things I noticed when I first started using that about 15 years ago, if you sat on a white towel, it was like somebody had drawn a black line around you. You know, it was all the petrochemicals coming out your system, probably from years of that was it. That was initially, you know, and you could smell
different colors.
Yeah, different colors. Yeah, I used to work in a factory.
And different odors. But I did it for a long time. And then I would hang the towel, and I would sniff the towel. It was like smelling salt. It was such a strong
ammonia type smell. And also I was in the 80s when I was got one of the first jobs I had. I was working in this place that made gymnastic equipment that used a lot of glue, and I could actually smell the glue coming out of me from 30 years ago.
Another thing, I don't know how scientific it is, but it's an observation. My observation is things seem to come out in layers. In other words, it's kind of like maybe there's so much of something, it mostly works on that, and then a few weeks or a month later, the nature of the smell and the sweat changes, and you're coming out with something else. But it's not, does not appear to be a uniform chelation, or not chelation, a uniform excretion of all toxins. But it does, in my opinion, eventually address all of them if you stick with it.
And it's like peeling back the layers of wallpaper if you go into an old house and you're going to renovate. But so exactly. One of the last ones, we hit on it, the COVID vaccines and the spike proteins and these horrible things that people are finding in the cardiovascular systems that they're pulling out. These clots, I'll call them, but they're like long strings of Is that caused? What's your findings on that? What is that caused purely by the COVID vaccine?
Well, I'm gonna drop a bomb on you here. We now have a cure for long COVID and persistent spike protein. Not make you better, cure you, and it works over 90% of the time. It was invented by a colleague of mine in Switzerland, Dr. Fabrice Lau, and in a nutshell, it involved ultraviolet blood irradiation, but not normal. It involved ultraviolet blood irradiation with one wavelength, 254 nanometers. All the other machines give you a broad spectrum, so you get a lot of everything and a little of nothing. And on the other side, a syringe filled with oxygen, and then the line is laid down into the machine, and it's what's called a hot ping pong therapy. You go back and forth with the blood and oxygen, back and forth, and after about 1.5 to 2 minutes, you re-inject the blood. And don't ask for an explanation. I can only give you a clinical observation. What it does do, though, is it knocks out abnormal D-dimer. So when people have elevated D-dimers, within a week or two, their D-dimer is back to normal. So they're no longer abnormally clotting their blood. And it's been just incredibly effective, probably over 90%, over 95% of the time. There have been very, very few. And it does appear to be a permanent solution at this point in time, because my colleague in Switzerland lives in a small town, and he's had patients that got treated years ago now. Hey, they haven't come back for a recurrence. I mean, it's not like it knocked it down and then a few weeks or months later it makes its way back up again. So somehow the spike protein is being either destroyed or somehow rendered irrelevant. Let's put it
broken down by the body, maybe, because it's been put in a better position to handle it, maybe, by the infrared.
And the Reardon Clinic now has that procedure. It offers that, and fantastic results.
Yeah, much to the dislike of the pharmaceutical moguls, no doubt. Want everybody to be vanilla.
Probably denied this. I mean, I've actually gone to one or two relatively prominent physicians that have a certain amount of fame, and they're not interested.
No, because
maybe they think I'm a fool or a lunatic. Maybe they think this is going to displace too many of the things I offer right now. I don't know.
I suppose to say that this works on spike proteins means that their pushing of the vaccine in 2021 was wrong at that point. They don't want to admit they're wrong, do they?
Oh, no, but it's well established. I mean, most long COVIDs are due to the vaccinations, not due to never having gotten over your acute bout of COVID.
Yeah, too right. Okay, then shall we leave it there? I think we've had a good chat there. Yeah,
sounds good, sir.
In and out. But everybody, I'll put all the links to where Dr. Levy's books can be bought from.
You might have an old email address. Okay, I mean an old website.
Yeah, forward on everything new, and then we've got fresh, if you can.
.com. Now it's just TomLevyMD.com.
Welcome to the Feelgood Factor podcast. Now please welcome your host, Dom Watterson.